Hi, my name is Dr. Wachtel. Today we're going to talk about diabetes and its effects on the foot and all the problems associated with it. We see an incredible amount of podiatric or foot problems that deal with diabetics. Diabetics for many years have been coming to my practice, and they have typical problems such as ulcers on the heel or on the forefoot. An ulcer is a opening in skin. It's typically due to pressure, and the way we treat it is by routine evaluation. Sometimes we have to cut down the callus or palliatively debride the lesion, we call it, with an actual scalpel, to prevent it from getting ulcerated. Many diabetics have circulatory problems. Over time, fat develops in the actual small arteries of the foot and the leg, and diabetics are more prone to circulatory problems in the foot. In our practice, if we feel that someone has a possible circulatory problem, we can provide what we call a PAD test, also known as a peripheral arterial disease test. This test is very, very important because what it does is it tells us if someone has the ability to heal. If they have a wound, their ability to heal. If their circulation is very poor, they could be at risk of heart attack or stroke. And we have a very, very simple vascular test that we do in the practice, where we put blood pressure cuffs on the leg and the thigh, then up right around the knee area and the ankle, and even around the digits of the toes. Lastly, many of our patients that are diabetics don't know proper care of their feet, so we go through a whole treatment protocol with them where we discuss their shoe gear, if they're hydrating their skin properly, if they're creaming their skin properly, if they're applying medicine to nails or toenails that might become fungal. That is another huge problem in the practice where we see diabetics. Fungal nails tend to get very thick, and when they get thick, they can create an indentation in the skin, and that can cause an actual abscess or infection under the nail. So these are all very important parts of evaluating diabetics. The main goal in our practice is to prevent ulceration and infection, so we do a good skin exam of the foot, we check the circulation. Lastly, a very big part of the practice with diabetics is neurologic status, the way someone feels their nerves. Some patients develop what we call neuropathy. Neuropathy is basically a burning sensation or a loss of sensation, and that needs to be treated appropriately, because if someone doesn't feel where they're going or where they're walking, they may develop a sore that won't heal. So, in a nutshell, the main problems with diabetics that we see in our practice are circulatory problems, skin problems, nail problems, and neurologic problems.